So today we're going to talk about tips and tricks for composite resin layering. The first thing that I want to remind all our followers is that November 14th, we will be doing a live webinar, a 3-hour live webinar on the topic of minimally invasive aesthetic restorative procedures, the no drill technique. We will have it November 14th, which is a Saturday from 10 a.m. to 1 p.m. If you want to get some more information or you want to register for this program, please visit our webpage, romerodentalseminars.com, and sign up for a newsletter. You will get an invitation to the presentation, and you will be able to make payments through our secure site. So please, if you would like to be part of it, make sure that you email us or you visit our webpage, and we will be more than happy to send some information your way. We want to thank our sponsors. You are being provided a one free CE credit for this presentation today once you complete a quiz. Thanks to these sponsors: Colteen, Oral Arts Dental Laboratories, Comet, B&Air Dental, and obviously Romero Dental Seminars. Uh, at the end of our presentation today, you will be able to find our quiz or the quiz for this presentation in our webpage. If you visit our webpage, Romero Dental Seminars, you will go under the link called webinars, and you will find 3 links under that webinar link. The live webinars, where you can subscribe or register for future webinars, future free webinars that we have. Our on-demand channel, where you can access all our previous webinars and videos, and our CE quizzes link, where you will find and be able to download any of the quizzes that we have had either previously or for our presentation today. Once you complete this quiz, you can email it to us and we will grant you the 1 CE credit for this presentation. Our objectives for today in the morning, our first objectives will be understand how to best isolate for direct composite veneers, how to effectively acid etch the substrate that you're going to be working on, understand how to apply the different layers of composites, and understand when to apply intensifiers. So let's get into our tip and trick number 1. So the first thing that I want you to know when we're trying to elaborate on composite veneers, or we're trying to deliver a direct composite veneers for our patients, the first thing that I would highly recommend that you do is identify if there is a color gradient on the natural tooth or teeth surrounding the area that you want to restore. As you can see in this photo, where I'm going to restore tooth number 8, I am visually inspecting tooth number 9 because that is the tooth that I need to match. And if you look at tooth number 9, we can all agree that on the cervical aspect of this tooth, you can see that the color gradient is more intense. You can see that there's more saturation towards the gingival aspect of this tooth compared to the incisal third. Actually, you can see not only more saturation on the gingival third, but you can see how that saturation diminishes towards the middle third of the tooth. So the tooth becomes lighter towards the middle third, and then finally, it becomes more translucent towards the incisal edge. The other thing that you want to see is that right at the incisal edge, there's a little bit of a white halo, a white line right at the incisal edge that creates this halo on the incisal third. So when you have teeth that have this type of color gradient, you have to understand that a simple or a single shade composite will not help you restore this case. On tooth number 8, this patient presented with a previous restoration, and regardless of the match of the shade that they selected was not ideal, you can see that this is a completely monochromatic restoration. There is no halo effect, there is no color gradient. So this is what we have to understand, that it really depends on the type of tooth, on the color gradient availability on the actual patient. And that's really going to be what we should identify initially so that we can decide which type of techniques we're going to use. And one of the things that I highly recommend when you're getting into this type of treatment options, obviously dental photography is a must, because now you can take a photo of your patient's natural teeth, the one that you're trying to match, and now you can sit down on your computer and just look at the tooth and start visualizing, okay, what kind of shades am I going to need to am I going to have to use for this particular case? How am I going to go about layering this tooth so that I can try to achieve the highest aesthetic result possible? So this is when color mapping comes into play. And what I like doing, and just to demonstrate here, I like to identify where are the areas where I have more saturation. And you can see here that I have highlighted the gingival third of the tooth just to make sure that I can remind myself that if I am going to choose a dentin shade for this portion of the tooth, I'm going to have to choose a dentin shade that has that is more saturated than the one that I would choose for the middle third. So let me just give you an example. If the basic color for this tooth would be A2, I know that I'm going to have to use a higher saturation shade for the gingival third. So that would put me most likely in an A3 shade for the gingival third. Now, if you look at this tooth, I can now identify exactly where that heavily saturated portion starts and where it ends. And at the same time, I'm going to be able to identify where where the lighter area or lighter body of the tooth actually starts. And you can see that I have identified that middle portion extending all the way down to three very well-defined mamelons on the incisal third. So if you look at this photo right here, now I know that I'm going to need to use at least two dentin shades, one A3 and one A2, to build these two areas of the tooth. Now, in between the mamelons, in between these three mamelons that I have been able to identify here at the body of my restoration, I can see that there's a little bit of gray. So in that color mapping, I'm going to identify how should I place that gray and where should this gray start and end so that I can then be able to replace or recreate the halo effect that this natural tooth has. So by doing this color mapping, you are now identifying, you're mentally identifying how should I go about restoring this tooth. And you can see here that I've added the gray. And finally, I'm going to add that little white opaque line at the incisal third to recreate the halo that the patient presented with. So again, what the color mapping does for you is just helps you identify these areas of greater or lesser saturation, the areas of translucency, the areas of white opacity. So that will help you kind of map and strategize your resin composite layering technique, because now you understand that layering is all about combining these different shades so that you can achieve a ideal final result. And I'll walk you through that process. So what is our tip and trick number two? Our tip and trick number two is to answer this question: is tooth preparation needed? Now, you will find some cases where tooth preparation is needed, like in the case that I'm presenting you right here. This is the same case as previously stated. You can see that the patient had a, uh, a restoration, a composite veneer on tooth number 8. This composite veneer was fabricated or was delivered to the patient due to this fracture that you are seeing here on the right-hand side of my screen. Now, because this patient had a previous veneer and the dentist that performed this previous veneer had prepared the tooth, when I removed this previous veneer, I went into the enamel because the tooth had been prepped initially. So I removed all the composite. Now you can see the fracture area and you can see the prepped enamel and the margin that was fabricated on this tooth. Now, when you're dealing with single tooth restorations, most likely you're gonna have to prepare because you have to compensate for the thickness of the restorative material. In this particular case, and this is one thing that I wanna be very specific about, is that the depth of the preparation has to do directly with the underlying color of the tooth structure. This means that if you have a tooth that is darker, the dentin and the enamel is darker than the neighboring teeth, you're going to have to prep more so that the thickness of your restoration is greater, and now you can compensate to hide or mask the darkness of the tooth that you're going to restore. On the other hand, if the tooth color matches the substrate of that prepared tooth, matches the surrounding environment, you do not need to prep as much because there's less that you have to compensate because there's nothing that you need to hide. There's nothing that you need to mask. So in this particular case, the tooth was prepped. So I obviously I couldn't control that. But most likely, if this tooth had not been prepped initially, my preparation would have been more conservatively. Because again, as you can see on the right hand side, both the substrate of the prep tooth and the substrate of the natural tooth number 9, the 8 and 9, they both match. So that means that I require very little preparation. And this is how you go about analyzing how much tooth structure you need to remove. Now you will have cases like this where these are 100% additive cases. This patient came to me because he wanted the diastema between 8 and 9 closed. So I have to add to close that space. And if I have to add to close the space, there is no need for me to prepare. So that's why you have to ask yourself the question, is there preparation needed, yes or no? And when you find that there is no preparation needed because you have enough space, because you have to fill a space, then by all means, just go about restoring the tooth by means of no preparation. Now, on our tip and trick number 3, there's one thing that you have to answer based out of that previous consideration. Are there any etching considerations that I need to take? And there will be different etching patterns or different etching times based on preparation or no preparation. When there is preparation, when there's been a burr in contact with the enamel, we all know that that rough surface created by the burr requires less etching time. So like in the case that you're seeing right here, if I have prepped enamel, I just need to etch for 15 seconds. If I have unprepped enamel, like the case that I showed you before, you need, or I would recommend that you double the time of etching. And the reason for that is because you most likely are going to have a layer of fluoroapatite on that enamel. And that fluoroapatite layer of enamel is more acid resistant. So when you prep, you remove that layer, acid resistant layer of enamel, so you can etch for less time and you will achieve a really good etched surface. But when you don't remove that fluoroapatite layer of enamel, I would highly recommend, and there's much research done in that area, we're increasing or doubling the time of etching with something that's been called dynamic etching, which is moving that acid, just making sure that you're creating a little bit of movement, or just pushing the acid around the tooth with a micro brush. That dynamic etching for 30 seconds will definitely help you achieve a better bond surface. Now, the other aspect is that when you are etching and you're restoring either single tooth or multiple teeth, I would highly recommend that if you're doing it one by one, or in this particular case where I'm only restoring one central incisor, I would highly recommend that you place Teflon tape on the neighboring teeth so that you avoid etching the enamel on the surface, the enamel surface on those adjacent teeth. Again, just Teflon tape, protect the teeth, and then you go about acid etching. 15 seconds for cut enamel, 30 seconds dynamic etching for uncut enamel. Tip and trick number 4. So what is the layering sequence? How do I go about layering? And I'm gonna walk you through the process of the actual case that we started with. That single central number, that single number 8, that we're gonna remove the old restoration and we're gonna redo a restoration. And the way that I like layering, and the way that I would recommend layering, is always starting from the lingual aspect. When you have, like this particular case, a class 4 type of fracture. And when you think about it, if you're going to start from the lingual, you always want to replace the actual substrate. Let's say that you're replacing enamel, you want to replace that enamel with enamel-like composite. So I would recommend that when you're trying to do layering techniques with composites, you use a system, a restorative system that enables you to choose enamel, dentin, and some type of intensifiers in order for you to achieve your aesthetic results. In this particular case, I have chosen a system that has an enamel shade. And as you know, and we all understand, enamel shade composites are more translucent. So we choose an enamel shade to start from the lingual. Now you got to keep in mind that when you start from the lingual and you have a fracture like the one that you are seeing here in this photo on the right hand side, I have to make sure that this enamel layer is not too translucent that will create a dark shadow on the incisal third of this patient, because this patient is missing tooth structure. So that's why you see here the combination of a very thin enamel layer on the lingual, and right on top of that enamel layer, another thin layer of white opaque. And that's why you can see here that this enamel layer is not completely translucent. It's more translucent towards the incisal edge and less translucent towards the coronal aspect of the tooth, towards the fracture aspect of the tooth. And the reason for that is because the reason why I do this is for that white opaque to hide that transition between composite and tooth structure, so that I can try to achieve the same opacity that's given to the natural tooth structure by the dentin. So that's why you see here a combination of enamel and white opaque. Once you do that, then I can start from the gingival, working my way down to the incisal third. And when we did the color mapping for this specific tooth, we had identified that we had more saturation on the gingival third and less saturation on the middle third, and that we had three well-defined mamelons. So that's what you're seeing here. I am using here A3D, which is an A3 dentin shade from the system that I'm using. I'm going to light cure that dentin shade, and then and you can see that I've only restored the gingival aspect with this A3D. Then starting right where the middle third and the gingival third meet, I start with my A2D extending almost all the way down to the incisal third, literally almost all the way down to the incisal edge. I am short of the incisal edge, maybe like a millimeter, because remember, we have a white opaque line that we need to add in this area so that we can reproduce the halo effect between the mamelons that we had identified during our color mapping exercise. So as you can see here, I have placed that A2D body and I have developed all three mamelons. And then I'm going to light cure that A2D, that A2 dentin, right on the middle third towards the incisal third of this tooth. Once I complete light curing this layer, I'm going to go ahead and add the translucent clear, which is a gray translucent that I need in order for me to mimic that grayish area that we all saw through the mamelons of this natural tooth. So with that translucent clear that I have placed between the mamelons, my expectations are that when I place my final enamel layer, this area is going to be more translucent because we have less dentin, which is more opaque, and more gray or clear translucent, which obviously is going to create that translucent effect in that area. And right before we place our final enamel layer, I'm going to add a little bit of the white opaque right on the incisal edge to reproduce the halo. Again, these are all features that I had identified during my color mapping exercise on tooth number 9. So all I'm doing is going about that color mapping that I achieved and making sure that I'm layering or that I'm placing all these layers of composite based out of that color mapping. So now I have the white opaque, everything is light cured, and now I'm ready for my final enamel layer. And I'll show you how I go about the enamel layer in another case, but here is my enamel layer completely placed. I am ready now to remove my rubber dam, remove the Teflon tape, finish and polish, and this is immediately after removal of the cord and removal of the rubber dam. And you can see that we have been able, and even though there's a little bit of dehydration on this tooth number 9 due to the rubber dam, you can see that the color match is almost on the spot. And we always want to tell the patient that our restoration is going to be a little bit darker once we're done immediately after the completed restoration, because the neighboring teeth will dehydrate because of the rubber dam. So we always do our final shade evaluation either a couple of days or a couple of weeks after we deliver the restoration. And this is now 30 days later, and you can see that on a black and white photo, this is the tooth that I restored. This is the natural number 9, and you can see that there is no visual difference in the value of my restoration and the actual value of the natural tooth, as seen as well in this color photo on the right hand side. The value of 8 and 9 is identical to the value of tooth I'm sorry, the value of tooth number 8 is identical as the value on tooth number 9. So we were right on the spot at the time of choosing the shade. But most importantly, what we want to show you is that you are able to reproduce all these natural features within the tooth by layering, by using a layering technique. And again, by understanding that the decision is made based out of the color mapping that you obtain. Because you will find patients that don't have color gradient or don't have a very accentuated color gradient from gingival to incisal. So those cases, you may be able to get away with them with a single shade or maybe a combination of two shades. But you will find some cases out there, and I would say many cases out there, mostly on young patients, that they have more color gradient, and you're going to have to layer more of these shades in order for you to achieve an ideal result. And here I'm going to go to my tip and trick number 5, which is how you go about getting the line angles, getting the right mesodistal width. How do you go about texturizing and doing tertiary anatomy? So how do you go about not only placing but finishing your restoration? So this patient came to us, and you can see that she had 2 composite veneers done on 8 and 9. Uh, Not only that, the shade wasn't most likely a good match. You can see that these are, at this point, this have been there for some time, so they're not new restorations. They were there for many years. But right now, you can see that they're slightly more, more. They don't shine as much. They don't have a glossy surface anymore. The line angles, they're not the same on 8 and 9. You can see that one tooth appears to be wider than the other. You can actually see the margin or the transition line between the composite and the actual tooth structure. So definitely, we can all agree that these restorations need to be changed. So that's what we're going to do for the patient. We're going to get her in to change both of these restorations. So the first thing that I would recommend for isolation purposes is that you go about retracting the tissue. So if you place a cord, and I normally use a 00 cord from Ultradent, if you go about using a cord, you know that you're going to retract the tissue, and that is going to displace the tissue so that you have more enamel available for you for you to etch and bond to. But number 2, and most importantly, you're creating some space so that you can then go about inverting your rubber dam. And when I'm doing this type of restorations, I not only invert my rubber dam by using forced air and pushing the rubber dam subgingivally, but I help myself invert or push the rubber dam more apically by means of a floss ligature technique, which I always recommend when you're working on anterior teeth and where you're going to do direct restorative work. Because as you can see on this photo, I have been able to heavily retract the tissue. I have a lot of untouched or uncut enamel available for me. And I'm not going to go all the way up there. I'm just going to remove whatever the patient has on composite, but I want you to see how much tissue you're able to displace and how much you are able to invaginate that rubber dam within the sulcus and keep this area nice and clean without any debris, any bleeding, or any curricular fluid affecting the areas that you're going to be working on. So once I did that and I retracted my rubber dam, I went ahead and removed the previous restorations on both 8 and 9. And all I did was just try to eliminate as much composite as I could. And there's a little more left here, so I have to use some finishing strips to get into these areas. And I'm just going to remove all that composite and just to get to nice and solid and healthy enamel. And you can see here now I've removed everything. I'm adding a Teflon tape on one side. You can see here on 7 and 10 Teflon tape, and right between 8 and 9 I'm using a Mylar strip, and I'm going to start with acid etching one of the centers. So I'm going to start restoring just one of them. I don't like doing both at the same time. This is something that this is just my preference. Many of you may like restoring both at the same time, and that's great. It just depends on the technique that you like using. I personally like doing one by one so that I know that I can do at least what I call a pre-finishing of one restorations, so I can get the right length and the right width. And that would allow me just to replicate that when I do my second restoration. So that's the reason why I like doing them individually. But again, this is all up to you. One thing that I do want to mention is because I was in the need of removing a previous restoration, all this is enamel, but this is now uh, um, this is an enamel that has been touched by a burr, I know that I have to etch less time. I don't need as much etching time as I would need if this was virgin or uncut enamel. So this is why we're doing a 15-second total etch technique on all that enamel. And once you do that, you rinse, you bone dry, and now I'm ready to apply my universal dental adhesive system. And I'm going to go here and I'm using here because the system that I'm using here is Mirage 2. This is the one that I'm going to use for this case. And this is a product done by Colteen. So right now I'm using the One Coat 7, which is a universal dental adhesive system that I'm applying on the entire surface of this enamel. And you will see it wet very nicely. Once you do that, and I apply 2 to 3 coats, I eliminate the excess by means of using a new and dry micro brush. And then by means of forced air, I'm going to gently air dry just to eliminate the solvent. And that will take me maybe 5 to 10 seconds. Once I do that, I'm going to light cure, and I have now my completed hybrid layer and ready to start my bonding procedures. So again, here I'm using Mirage 2 from Colteen. And what I did here first was I needed to add some length to the teeth. Patient was unhappy with the actual length of 8 and 9. They were just too close to the length of 7 and 10. So we decided to add half of a millimeter more of length to 8 and 9. So I'm adding a little bit of enamel on the lingual aspect of this tooth number 9. And once I do that, I'm going to add a little bit of the white opaque because the patient had a white halo effect on the inside. So third, this is a young female patient. And you can see here I'm using an endo file, a very thin endo file, just to go about applying a little bit of that white line. I tend to apply this white line with some irregularities inside so that it appears to be natural. You do not want a straight white line because that's not the way natural teeth are designed. They really have these white opacities very in a very irregular pattern. So you want to try to follow that just to give it more of a natural look. Once we did that, we light cure that first layer of white opaque, and now we start placing a very thin layer of dentin. So we're going to use high a very light dentin, high value dentin, a very thin layer, because again, there is not a whole bunch of room. You can see that I barely have some room to develop some line angles with my enamel. But just because I want to intensify the color and I wanted to give it a little bit more of higher value, I added a very high value enamel, and I'm using this type of brushes to just go in and smooth that layer so that we eliminate any bubbles. And the other reason why I like using these brushes is because I can get some texture built in that layer composite. That when I add my enamel layer and the light goes through the enamel, this dentin with a little bit of texture will break the light just like natural dentin would do with light. So once I apply my dentin, you can see it was a very thin layer of dentin. I'm ready to start building now my enamel layers. And one thing that we had discussed in a previous webinar, and you're more than welcome to visit my webpage, we have a video on this. This is the technique that I recommend using to build the line angles. This is what has been called the Mylar pull technique. Uh, and You can see me here using a Mylar strip, a very long Mylar strip, adding the mesial line angle. This is only enamel. I'm now only using enamel shade, a high value enamel shade, and I'm going to apply it against my Mylar strip. I'm going to pull my Mylar strip, and the whole idea is for you to develop your line angle. And now I have a well-developed and uniform mesial line angle. I'm going to go ahead and go about doing the same thing on the distal. You can see here that I've achieved now a distal line angle, and these are all been pre-cured. And now I'm ready to add my final facial enamel layer, and you can see it right here. So I have completed restoration on tooth number 9. I'm going to now start what I call my pre-finishing of this composite layer, composite veneer, I'm sorry. I'm going to make sure that I get the right length. I'm going to make sure that I get the right mesial distal width by playing with my line angles. And again, it's just a pre-finishing. I'm drawing exactly where I want my line angles. What are the areas that are going to be affected by my disc? What are the areas that are going to be non-affected by my disc, so that I can keep that ideal mesial distal width? And you can see here, this is what I call the pre-finishing. Now all I have to do is try to duplicate this same shape on tooth number 8. So this is the reason why I like doing one tooth at a time. I'm going to go about just adding a little bit of tertiary anatomy there, and there I go. I protect the neighboring teeth, and I go about restoring tooth number 8. Acid edge, prime and bond, lengthen the incisal edge, add the white opaque, add the very thin dentin layer, mesial mylar pool, distal mylar pool, and final facial increment. Exactly the same steps that we did before. Now we start polishing, and this is the shape guard system developed by Colteen. And you can see that what I like about shape guard is, and you go about using first the lighter wheel, and then you go to the or the darker wheel, so it's pink and blue. And what you do is that I always recommend using a little bit of water, and this is my final polishing sequence. So I go about using my diamond burrs to recreate some of the texture. I go about using some finishing disc so that I can get the right shape and the right length. And then finally I do my polishing, my high gloss polishing, using these the shape guard wheels. And the reason why I like these shape guard wheels is because you get a high gloss without without removing the texture that you work so hard to obtain by means of using different diamond instruments. So this is my final restorations immediately after rubber dam removal. You can see 8 and 9. You can see the high gloss that I was able to achieve by using shape guard. You can see a little bit of the tertiary dentin, and you can compare that to the lateral incisors. You can see that it's almost invisible to see the transition line between the enamel layer and the actual tooth structure, but you can see that my restorations did not go all the way to the gingival margin, but I will allow the tooth to rehydrate. Again, always tell your patients you're going to have to wait for that. And this is how we started the case. And this is 15 days later. You can see the transition between the composite and the tooth structure on the gingival third is very seamless. You can see the high translucent effect that we were able to achieve in the incisal third by means of combining all these different colors. You can see now how the shade blended in well with the lateral incisors and the canines. You can see the tertiary dentin and the way that the light is broken when it reflects to both 8 and 9. And in a full smile, you can see the smile improvement and the added length, the added dominance that the patient wanted and that we wanted to help her achieve on both 8 and 9 by lengthening the central incisors. So with this is our final slide. And we hope, like always, that you have enjoyed our webinar today. And we will get ready for some questions and answers.